We'll go ahead and get started. I'm Tracy Seward. I'm the Senior Director for Outreach and Recruitment at ASPPH. Thank you so much for joining us today. With me, I have JT from the CDC, who's going to be talking about the Public Health Associate Program. So with that, I'm going to turn it over to JT.
Great. Thank you, Tracy. Hi, good morning. Welcome everyone to our session. We appreciate the offer, Tracy, to partner with ASPPH and talk a little bit about the Centers for Disease Control and Prevention's Public Health Associate Program. We kindly refer to it as PHAP, PHAP, the Public Health Associate Program. You will hear me reference that over the next hour as PHAP. We can move on to the next slide. Okay. You can ask questions in a variety of different ways. You can ask through the Q&A function through the bottom of your browser window that you've got open. That'll submit questions, which I will be monitoring. You can also put them in the chat that Tracy will be monitoring. So you can submit questions throughout. We'll probably take questions towards the end of the session, and the meeting will be available on the next slide. The meeting will be available on the website through asppph.org. Tracy will make sure that the link is available to the recording so you can reference it, or you can share the link with other individuals at your organization who might be interested in hearing a little bit about the Public Health Associate Program, or PHAP. Let's move on. So I have a quick poll question just to kind of get an idea of your understanding and knowledge level of PHAP. Tracy, are we able to launch a poll and get the results to this simple A, B, or C response questions?
Let me try to set that really fast.
All right, I'm sorry about that, but just to get an understanding of your level of understanding of PHAP, of the Public Health Associate Program, I want to start at the right level of understanding to talk a little bit about what PHAP is. It's good that I have an understanding of what your knowledge and experience of PHAP. If you've had no knowledge of PHAP at all, and this is the first exposure that you have to PHAP, or have you heard of PHAP but don't know anything about PHAP? Or are you fairly well informed on the Public Health Associate Program? So to give me a better idea, oh, perfect. Thank you very much, Tracy. So if you can give me an A, B, or C. A, if you have no experience at all with PHAP, okay, you've never heard of PHAP until today. B, you have heard of PHAP, but would still like to get a little bit more information. And C, if you are very well informed about PHAP, maybe your host organization has hosted an associate, or you're familiar through a variety of different exposures and experiences to PHAP. So if you can go ahead and vote now, that would be great. And Tracy, I'll defer to you as to when to close the poll based on the number of participants that we have on the line and the number that have responded. Awesome, awesome. So this is great. So majority of you have little to no experience with PHAP. None of you have been well informed about PHAP. It gives me a great learning place. So thank you very much for your response. We appreciate it. Let's move on to the next slide, Tracy. For those of you who have, well, we're going to skip this because none of you have heard about PHAP. Let's skip the next slide. Okay. Let's move on, Tracy, to the next slide. Let's skip this slide, move on to the next one. All right, so this is PHAP. PHAP is a group of young professionals who are new to public health. They are CDC employees. They are the future of public health. This is a 2-year training program. We bring in collectively of 180 to 200 young professionals every year in October that start the Public Health Associate Program. It is based here in Atlanta at headquarters of the CDC, where Centers for Disease Control and Prevention are located, but the associates do not do their work here at headquarters. They're what we call field assignees. They will actually come to your organization and work at your organization, or students will relocate from where they live to a new host site, city, and state. But this is the last couple of years of associates that we've had come into the Public Health Associate Program. Let's move on. PHAP is a field-based experiential learning program. So the associates, the candidates themselves, really do get some robust hands-on experience in public health. They're involved with the community. They're involved with cohorts. They're involved with different members of the community and different colleagues of the host organization. But it is truly a hands-on, non-academic program. About 95% of the experience of the 2-year training program is experiential learning. They truly are indiscriminable between the host site's organizational staff and an associate, despite the fact that they are CDC employees. Let's move on. Believe it or not, this is an associate that we had in Wyoming. This is where his host site was located, in the middle of Wyoming. This is an example of the hands-on work that associates will provide to their host organization for the 2-year duration of the program. Let's move on. Let's talk a little bit about what PHAP is. Public Health Associate Program is a 2-year paid competency-based training program. This is 2 years from beginning to end. There is a beginning, a middle, and an end to PHAP. They are paid employees of the Centers for Disease Control and Prevention, or the federal government. They are federal government employees during the time that they are in the program. It's a competency-based program, meaning that the competencies are a series of, within a series of domains, that we have 11 domains. We've got about 54 competencies that the associate must meet over the 2-year duration of the program. These are federal government employees while they're in the program. This is a partnership and a collaboration between CDC and host sites. The host sites can vary. They say, JT, can our host site apply if we are a non-governmental organization? Can we apply if we're another federal agency? Can we apply if we're a tribal entity? The answer is very simple, is if you can offer the associate work activities that give them opportunities to meet the competencies of the program, the answer is yes. You do not have to be a state, tribal, local, or territorial health department. You do not have to be a non-governmental organization. You can be an academic institution. You can be a hospital. You can be a state. You can be a tribal. You can be a local or territorial health department. But as long as you give the associate opportunities to meet the core competencies of the program, we welcome host sites to apply to be host organizations for the 2-year duration of the program. Let's move on. The mission of PHAP is very simple. It's got 3 big components I'd like to focus on. The first one is that we provide training and experiential learning to early career public health professionals who contribute to the public health workforce. This is a training and experiential learning program. This is 95%, as I mentioned earlier, is based on hands-on. The organization that the associates will be placed on will be responsible to provide them with experiential learning, hands-on learning, doing, teaching, training, providing them with training opportunities at the host site, and experiential learning opportunities to early career public health professionals. The associates themselves have to be early in their careers. They've got to be within 2 years of graduating from their most recent degree. 2 years of graduating from their most recent degree. That could be an undergraduate degree or a master's degree. It could even be a PhD. We have some individuals who are graduates of PhD programs who want to be a PHAP associate, but they're truly early career public health professionals. We expect them to have little to no public health experience. Right? These are early in their careers. They don't have to be right out of undergraduate school to say they're 23 or 24 years old or 22. It could be somebody who is a non-traditional associate who may have gone back to his or her undergraduate or master's degree a little later in their career, but they're still early career public health professionals. They've got to contribute to the public health workforce. This is a dynamic, tactile, hands-on learning program that the contributions of the associates themselves contribute to the goals of the host organization. So the work that they're doing at their local entity for the 2-year duration will help the association or the organization meet their strategic goals. So therefore, they're contributing to the public health workforce. So again, it's to provide training and experiential learning to early career public health professionals who contribute to the public health workforce. Next slide, please. Let me talk about what PHAP is not. PHAP is not an internship. These folks come out of undergraduate or graduate school. They have a proven academic record of success. The program is a competency-based program. We ask our host sites to determine and pre-identify the work activities that they will be involved in for the 2-year duration. So it's not an internship where folks are doing what needs to get done during the time frame that it needs to get done. They're pre-thought, preconceived, pre-planned work activities. It's not an administrative staffing support program. Although some associates might do some administrative staffing support activities, the activities that the associate is involved in should always have some linkage to the competencies of the program. They should not be scheduling meetings or taking care of their supervisor's calendar of events for the week and so forth. If they're scheduling meetings, they should participate in the meetings. They should gain some knowledge and experience from the experience of participating in meetings themselves, but it's not an administrative staffing support program. This is not a federal government employment service. This is a training program. There is no guarantee of a position at the end of the 2-year duration. We will do diligence to make sure that the associates after the 2-year training program are exposed to programs that might be seeking an individual who will then have had 2 years of field-based experience, but there is no guarantee of a job after PHAP. We'll do diligence to connect the associate with organizational opportunities at the state level, at the local level, at the city level, the non-governmental organization level as well. But again, there is no guarantee of a job after PHAP. And these folks are not CDC subject matter experts. These folks are early in their careers. They come with little to no public health experience. They come with the desire. They come with the ability to add value to a host organization's endeavors and efforts, but they're not CDC subject matter experts. Let's move on to the next slide, please. Okay, these are the 11 P Hap competency domains. Okay, as you can see from the list of domains, they're early career public health professional domains: analytic and assessment, public health sciences, program planning, management and improvement, public health policy and law, basic things like professionalism. Okay, many of these folks will be brand new out of undergraduate school or graduate school, and this might be their true first professional employment opportunity. So we want them to learn opportunities to be a professional, what it means to be responsible and accountable for certain responsibilities and work activities. We expect them to have fairly good communication skills. We'll talk about communication as a criteria that we expect the associate to possess, but we'll build on their communication skills, not only their verbal communication skills, but writing skills, presentation skills, social media skills, and so forth, that will enhance the associate's capacity and ability to communicate effectively using both the written word and nonverbal communication. Health equity. We all know that health equity is a common theme in public health today and will be. The associate must be sensitive to other cultures and be aware that there are other individuals that have different beliefs, different cultures, different ethnicities, different beliefs that they do than they do, and must respect and honor those. Okay, community dimensions of public health funding, okay, budgeting and so forth. We'll talk to them a little bit about budgeting and to understand the components of a budget. Basic evaluation. What is an evaluation science? How do they use data for decision making based on evaluation? And then public health emergency and preparedness and response. We're now in the middle of a pandemic. Okay, so we've added public health emergency preparedness and response as it hits all of us in the public health and healthcare environment. Okay, let's move on, please. Let's talk a little bit about the associate benefits. What benefits does it come to a candidate who is an associate? Okay, they are a CDC employee, okay, for the 2-year duration. They're not based here in Atlanta, they're based in the field, but they are a CDC federal government employee for the 2-year duration, okay? They get paid with the salary and benefits of a federal government employee. So they will receive a paycheck every 2 weeks from Centers for Disease Control and Prevention, as well as health benefits for the 2-year duration of the program. The expense of the associates being at the host site is minimal to negligible, and we'll talk a little bit about the expense to the host organization. But CDC pays the salary and benefits for the associate during the 2-year duration. They really do develop what we call transferable career skills, transferable skills. This is what we call as a generalist training program. The associate might be in an STD or sexually transmitted disease assignment. They might be working in preparedness. They might be working in diabetes management, obesity prevention. Whatever subject area the associate is working on, they will develop competencies and skills that are generalist. Things, for example, like basic writing skills, basic presentation skills, basic public health funding skills, basic public health law skills. They will not be subject matter experts in the subject area that they are trained in or that they're spent their 2-year training in. This is a 2-year hands-on public health experience. So for those candidates who meet the best fit criteria, who enjoy hands-on tactile learning experience, we would highly encourage that you identify these candidates and encourage them to apply to PHAP. These are trainings at CDC and in the field. They are field-based assignments, but we have 3 in-person training events here at CDC on campus in Atlanta that we will bring the associates on CDC's funding to Atlanta for 1 week of training at the beginning, 1 week of training in the middle, and 1 week of training at the end of the 2-year duration. Now, given the pandemic, we have been doing these trainings virtually, but the intent and the goal is that we will bring the entire class of associates together 3 times throughout the 2-year training, 1 at orientation, 1 after 1 year of the program, and 1 at the end of the program. They also have supervisory support. We have 2 supervisors, 1 official and 1 unofficial supervisor of the associate. Each associate will have a CDC supervisor of record. That is the official supervisor over the associate. He or she is usually based here in Atlanta. They've got responsibilities for the administrative support and guidance over the associate for the 2-year duration. Also, we have what's called a host site supervisor. The host site supervisor is the individual that is located at the host organization where the associate is doing his or her 2-year assignment and has responsibility to manage the day-to-day operations of the work and oversee the day-to-day supervisory skills of the associates working day-to-day. They will guide them, they will coach them, they will take them to meetings, they will supervise their day-to-day work and provide them with supervisory oversight on a day-to-day basis. The supervisor at the host site is not the official supervisor of record, but he or she has input into the supervisor of record's assessment of the overall performance of the associate during the 2 years. So the host site supervisor and the CDC supervisor work closely together. They're partners, they're joined at the hip in overseeing the work of the associate on a day-to-day basis. We also have a mentorship program. The mentor is an individual who is based at CDC, who's got at least 5 years of federal government work as a federal government full-time equivalent and is not involved with the work of the associate on a day-to-day basis. He or she is a mentor. They're a coach. They're expected to meet with their mentor at least once a month. They're not in their chain of command. So truly the associate has a confidential partnership or a bond with their mentor over the 2-year duration. The mentor is responsible for things like career coaching. What is your plan after PHAP? Do you want to go back to graduate school? Do you want to convert to a CDC position? Do you want to stay in the field as a local assignee of CDC? Would you like to stay as a member, an employee of the actual host organization? But to talk about their lessons learned and experiences that they've experienced throughout their career and coach and guide the associate throughout his or her 2-year training program. This is valuable work experience that is with a respected federal agency. CDC is not only domestically well known, but internationally well known. So they get the opportunity to work for a very well respected federal government agency. And they're actually qualified for positions after their completion of the 2-year program, depending on what their own personal interests are. If the associate would like to stay with CDC, like I said earlier, we'll give them opportunities to meet with hiring managers at CDC. We'll share their resumes with potential hiring managers at the state level, at the local level, the non-governmental level. So we'll do diligence to make the connections between an associate and a hiring manager afterwards, knowing that the PHAP program is not a job placement agency. We're not guaranteeing a position, but we will do diligence to connect the associate upon graduation with potential opportunities. Let's move on to the next slide, please. The associate will also be available to what we call deploy as a public health emergency responder. All of CDC employees are trained and are available to deploy to help public health emergencies. Here you see some of the new and recent public health emergencies that CDC staff has responded to: 2015 Ebola, Zika, measles outbreak in 2019, and now since 2020, the COVID-19 response. We've had over 300 associates have responded to support public health emergencies in the field, either locally at their own host site or domestically at another host organization for a period of 30 to 60 days, or even come to Atlanta to help with the Emergency Operations Center functioning during a public health emergency response. But we've had a number of associates who have responded, stepped up to the plate, and deployed during the 2-year assignment. Let's move on to the next slide. I want to spend the time talking about the best fit model. The best fit model is a series of characteristics that PHAP has identified when you are working with candidates and thinking about candidates and encouraging them to apply. These are the 7 characteristics that we would like you to keep in mind. We'll talk in detail about each characteristic, but is the candidate a big picture thinker? Does he or she have the capacity to actually think beyond the work that they are doing and the impact that their work has on the bigger picture of public health? E is effective communicator. Do they have the capacity to be eloquent speakers, both verbally and non-verbally? Do they have the capacity to string 2 words together and complete a logical, coherent sentence in writing? All right, those are the basic core skills. We don't expect them to be the most effective communicator, but have the potential to be somebody who can learn new skills, learn how to develop their writing, learn how to be a more effective communicator. They've got to be socially and culturally inclusive. We talked about health equity as a domain. So respecting individuals from different socioeconomic, cultural, ethnic diversities, gender differences, gender identity, sexual orientation, different ages, and so forth, that they've got to be socially and culturally inclusive. They've got to thrive in a dynamic environment. PHAP as a program is a dynamic program. If an individual likes to know that A is going to follow B and B is going to follow C and so forth and so on day 1, 2, and 3, this program may be the death of them, to be honest with you. This is a dynamic program. We'll talk a little bit more about the dynamics of PHAP in a few minutes. They've got to be flexible. Flexible is probably the key variable that we look for. Flexibility, the ability to change and to adapt to changing environments while maintaining a positive mental attitude, which is key. Okay, so we'll talk a little bit more about flexibility. The I is intelligence. They've got to have a minimum of a grade point of 3.0 or better in their most recent degree to be considered a candidate for PHAP. So they've got to have the demonstrated capacity to acquire new academic skills, theories, principles, and so forth. That will be identified by a 3.0 or higher grade point. And the last T of the model is they've got to be a tactile learner. They've got to be hands-on. This is not an academic program. As I mentioned earlier, 5% of the program time will be in an academic sense, where they will be in online learnings, they will be in in-person learning events, they will be taking self-paced courses and so forth. But this is a tactile learning and teaching program. Let's move on if we can. This is a distribution of where our associates are assigned by state or US territory. We see we have multiple states. I think we've got 46, 44 states, associates in 44 states. We have them in 3 US territories, in Guam, Puerto Rico, US Virgin Islands, the Commonwealth of the Northern Mariana Islands, or CNMI, which are part of the US territories. So we have a wide variety of host sites that apply and are awarded an associate. So we may ask 6 or 10 associates to relocate to the state of Texas. We might ask a half a dozen to move to Colorado, or a few to move to Nebraska, and so forth. It all depends on where the host sites are applying for on an annual basis. Let's move on, please. The 2021 associates just started the program on October the 12th, just a couple of months ago. We had 183 new associates start the program in October. They will graduate in October of 2023, October of 2023. Believe it or not, this week we have about 25 of the associates in for orientation. We've broken them up into smaller groups this year, but this is the first time that we've brought associates into Atlanta for orientation to get them a badge, to get them through clearance and so forth, to get them in the CDC systems in 2 years. So we are thrilled to see them in smaller groups of 25 individuals. We're taking them around campus. We're orienting them to different organizations on campus, but it's absolutely wonderful to see them. But we started 183 in October of 2021. About 65% of those folks have bachelor's degrees, excuse me. About 65% have bachelor's degrees. So many of them are new out of undergraduate school. Majority of those folks are early in their careers, but are new in a professional position. Many, these are the first paid job out of undergraduate school. We have 34, usually between 34 to 38% have master's degree. This year, 34% have a master's degree, okay? Some of those might be a little later or non-traditional associates. The majority are out of their master's degrees, having just received their master's coming straight from a bachelor's program. So they too are new or early in their careers. A majority of master's degrees are masters in public health, public administration, MBAs, and so forth. But 34% have master's degree. We have 1% that we have doctorate levels as well. So it's not unusual to have a doctorate level associate in the program as well. But that's a distribution of the 2021 associates that started in October. We can move on, please. Okay. This is our last year's host site assignments. So you can see the number of assignments by percentage breakout of 185 that started the program in 2020. The majority of them are located in local health departments, county health departments, city health departments, and so forth. So the majority are in local health departments. The next biggest group is at the state level, usually in the state capital. They'll work at the state level to give the associate opportunities to meet the competencies. Then it has a pretty significant drop off. We see territorial health departments, tribally focused organizations, either with American Indian, Alaska Native tribes, or tribally focused assignments. We have 3% that are non-governmental organizations, either a CBO, a community-based organization, or another non-governmental organization, we have between 3 and 9%. We've got 1% that works in an academic institution, okay, working with organizations that are providing public health services or working academically with public health entities. And we've got 11% that are working with other federal agencies, such as a quarantine station or the National Park Service Organization and so forth. So this is the distribution of where the associates will work over the 2-year duration of PHAP. Let's move on to the next slide. These are just, excuse me, these are just some examples of associate experiences, some of the subject areas that the associates may work in over the 2-year duration. They might work in STD, TB, or HIV prevention. They might work in chronic disease-related assignments. They might work in immunization-related assignments, injury prevention, and so forth. But there's a variety of different subject areas. They might work in accreditation. They might work in minority health or health equity. But there's a variety of subject areas based on the host organization's needs. The associate will spend the entire 2 years in the same subject area, So if they're working on obesity prevention, they'll be working through obesity prevention through the 2-year duration of the program. Let's move on, please. The associate eligibility criteria, this is important for you to be aware of because these are the criteria for an associate candidate to be eligible to apply. And we'll talk about the application process so you are aware at some point in time as well. But they've got to be a US citizen, a permanent resident, or a US national to apply to be a PHAP associate. At graduation, only US citizens are eligible to convert to CDC positions for long-term employment. But we do accept US citizens, permanent residents, or US nationals as part of the 2-year training program. As I mentioned earlier, the I of the best fit model, intelligence, they've got to have a 3.0, a grade point or higher in their most recent degree, okay? So they've got to have a proven academic record of success and the capacity to learn new skills academically through practice and policy. They have to have received a university degree in the last 2 years. Okay, so somebody who graduated 3 years ago with their most recent degree would not be an eligible candidate for PHAP. They have to have a 4-year degree from an accredited college or university within the last 2 years. This is truly an early career public health professional training opportunity. So within the last 2 years of their most recent degree, they've got to be committed to public service. Public health is not, it's a selfless giving organization that we give across the field. Those of you in public health across the field, you know you've got to be driven to give to the public service. You've got to be passionate about public health. Okay, you've got to have some kind of interest in public health. We've had candidates who maybe have an undergraduate degree in public health. Maybe you've gotten a master's degree in public health. Fine. We have other candidates who might have an undergraduate degree in English literature and maybe have volunteered at a health fair at a local community fair and was interested in public health and health education and would like to learn a little bit more about public health. This is the program for them. This is the program for them. The more experience that a candidate has does not make them a better candidate for PHAP. PHAP is truly for those candidates who are little to no public health experience, okay? They have to be able and willing to relocate at their own expense. Unfortunately, the federal government does not have the resources or the funding available to relocate 180 to 200 individuals every year. So they've got to be willing to relocate from their current housing situation to their host site, city and state on their own expense. And then at the end of the program, relocate to their next position on their own expense as well. So relocation expenses are not covered. There are some potential funding and some relocation incentives that we can work with those who are stationed in the US territories, such as Guam, CNMI, Hawaii, Alaska, and so forth. But predominantly, the associate must be willing to relocate to their new host site, city, and state at their own expense. And they've got to be committed to work for 2 years. This is a 2-year training program. Once we get an associate candidate who has been accepted into the program, we'll do our darndest to keep them in the program. This past year, we had over 2,400 applications for what turned out to be 183 positions. So we have many, many thousands of applications to PHAP. Once we go through the process, and it's not an easy process to go through, we want to make sure that the associate is committed to stay in the program for the 2-year duration of PHAP. Let's move on, please. Let's talk a little bit about the application process. There's 3 phases to the candidate application process, and I will talk to you a little bit about each of these phases and what you can recommend happens moving forward. The first is the application phase. These candidates must apply through usajobs.gov. This is the website to all federal government employment opportunities, usajobs.gov, usajobs.gov. Someone said, JT, what would you recommend the first step be? My recommendation is to encourage candidates to set up a profile today on usajobs.gov. It's free to set up a profile. It takes some time to set up a profile. So the sooner that they can set up a profile in usajobs.gov, they're a step ahead of the process. The application period, which we'll talk about, opens up next month in a couple of weeks. It'll open up on January the 17th and close on January the 24th. It's a very short application period. The 17th of January through the 24th of January. Therefore, if they can set up a profile in USA Jobs, they're one step ahead of the process. So that's the application phase. The next phase is that human resources will go through and identify all of those associate applications or candidate applications who meet the minimum criteria of a 3.0 or higher grade point average, being within 2 years of their most recent degree, and are a U.S. citizen, a permanent resident, or U.S. national. So they will go through and they will identify those candidates who meet those 3 criteria. Those names of individuals are then referred to the program. They're referred to us in the Public Health Associate Program here at CDC. We will then invite those candidates to respond to written questions or the personal statement phase, phase 2. This is the second step in the process. We'd like to see the associate's capacity to string 2 words together and complete a sentence, complete a thought, convey a thought through written words. After that, we will score those written responses. We will take a subset of those individuals and we will invite them to complete a virtual interview. CDC staff will interview candidates virtually over Zoom, and we will actually talk to them about their experience, not necessarily about their public health experience, because remember, they have to have little to no public health experience, but talk to them and see, can they convey a thought using the spoken word? Are they fairly eloquent? Do they have the capacity to convey a thought using using of oral words or verbal words? So then we'll take a combined score of these 3 steps in the process. The process starts in January of 2022. The virtual interview phase may take place in April or May. So somebody who is looking to apply to a program and hear within a week or 2 whether they get in or not, this program will be the death of them. Okay, they will not get a response. There is a 3-phased approach. So somebody who is flexible, again, the F of the best fit model, who can kind of adapt to changes and adapt to changes with a positive mental attitude will do well. If there's somebody who expects to have A after B after C and expects it to be done on time, the program might be a little frustrating for them. All right, so let's move on. This is the annual timeline of events that are coming up in the next couple of months. In January 17th through the 24th, that is when the application will open up in usajobs.gov. So if you have candidates who are interested in being an associate, have them log on to the website, which is cdc.gov/PHAP, PHAP. It is in the public domain. It will give all the necessary information on the candidate and the host site application process. There's a site on there on the first page. It'll say, interested in becoming an associate? Click here. That'll navigate through talking about experiences that former associates will share with potential candidates, talking about work activities that they'll do, talking about the timeline and the relocation and the federal government benefits of being an employee of CDC on the website. It'll open up, the application will open up January 17th through the 24th. The 24th at 11:59 p.m., the application will close. The application will close. So we encourage the candidates to apply early in the open period, not to wait until the 24th. We have a number of candidates that are applying. We had over 2,400 apply in 2021. We expect the same number or higher in 2022. If the system is at its capacity at 11:59 on the 24th of January and the associate does not get his or her application submitted, it will not be accepted. They've got to wait an entire year. We will not have any kind of exemptions beyond 11:59 on the 24th of January. The host sites will be applying simultaneously. So all of the host organizations across the US and US territories will be applying in January and February to host an associate. This is where the host sites will tell us what kind of work activities the associate will be doing. Who will be the host site supervisor? What kind of training opportunities will the host site offer the associate? And is this a good match to receive an associate? In February, March, and April, that's when we will do the candidate application reviews, phases 2 and 3 of the host site application process, the writing samples and the in-person or virtual interviews. May and June of next year, this is when we will do the candidate and host site matching. We'll actually go through all of the host sites applications that we have accepted and the candidates, and we will match them based on their interest, based on their geographic preferences of where they can relocate to, what their subject area of interest is if we can match to a host site. So we will go through the matching in May and June. In July is when we will start to notify candidates of their outcomes of their application. We will start to notify them in July. So the process starts in January. So in July of next summer, we will start to notify associate candidates of the outcome of their application. And if their application has been accepted, where their host site potential match is, and if they're willing to accept the offer. We start in January. In July, we'll start the matching process. One of the frustrating things that we get comments on all the time is this: they say, JT, you make me wait, and then you expect me to respond within 24 hours or 48 hours on if I accept an offer. That's a nature of the federal government. Unfortunately, they will apply in January. They will wait until February before we actually go through the applications and review all of them for success and potential skills in making it a successful candidate. We'll ask them to submit a writing sample. We'll then make them wait, and then we'll schedule an interview, and we'll make them wait, and then we will match them, and then we will say, hurry up and tell me if you would like to respond to this, because we've got a number of candidates that are in the matching lineup. But that's the nature, that's the flexibility characteristic that we expect of the associates. So in June, July, and August, we'll notify the associates. In October of next year, they will be expected to have relocated to their host site and be ready to report to work in mid-October, the day after Columbus Day in October of 2022. Okay, so that's the outline of the timing of events coming up for the 2022 application process. Let's move on to the next slide, please. So here's my main ask of you. The main ask is to visit cdc.gov/PHAP for more information about the program, is to think about students or former students who have graduated who might be the best fit candidates. Which one of those students are big picture thinkers? Which one can you think back were effective in communicating a message in written word and in oral or verbal speaking skills? Which candidate might have been sensitive to, excuse me, socially or culturally insensitive or inclusive of other individuals who are different than themselves? Who thrives in a dynamic environment? Who is able to take changes in events and go with the flow and flex and bend? Who is flexible and can adapt to changes with a positive mental attitude? Who demonstrated intelligence? Who's got the capacity to learn by demonstrating and learning new skills? And who is a tactile learner? Those individuals who like to get their hands on and actually do the work and get involved in the day-to-day work of the actual host site application. Share information with other faculty, with other individuals who might be able to identify who a good or best fit candidate would be to PHAP. All right, that is awesome to identify those candidates and share this information with other faculty. Okay, share this information with other prospective host sites. Maybe your organization might be a good location for a host site, perhaps, that you can offer work activities that could engage the associate and offer them opportunities to meet the competencies. The competencies can be found on the PHAP website. They can be found on the PHAP website. They're the 2022 competencies. We're piloting new competencies for 2022, so they are there. So if your organization can offer work activities that can help the associate meet the competencies, then consider applying to host an associate yourself. Okay, let's move on to the next slide. I think that ends it. Okay, so we've got some time. We've got about 10 or 12 minutes. Tracy, would you like to read questions from the Q&A? Would you like me to read them? Or would you like to read them from the chat? How would you like to proceed?
Happy to do whatever you prefer. There
Okay,
are a bunch of questions.
all right. Let me go ahead and read the questions in the Q&A first, and then you can read what comes up in the chat. How's that sound?
Perfect.
All right, very good. A question came in, says, how many PHAP associates go on to pursue additional studies in public health, grad or doctorate school? Many, many of them. We've got outcome and evaluation reports on the website that talk about the disposition of the associates. We see about 30% will either go back to school after PHAP or will go to school while employed as a public health advisor or employee after PHAP. So about 30% will go back into school or academia. Okay, it says, are recent graduates of an MPH program able to be considered? Would that constitute too much prior experience in public health? Absolutely not. MPH programs are very, very good feeders for associates. We're talking about work experience. We're talking about little to no public health work experience. Academic experience is a great, great precursor to PHAP. So encourage your candidates who have masters in public health. Majority of our masters prepared associates are MPH degreed. So they do not have to have a master's in public health, but those are great candidates. Encourage them to apply. Okay. The next question says, are there specific background, either work or education, that you are looking for in candidates? Let me stop there. The background is very diverse and eclectic. 49% of the candidates that apply, 49% of the associates who are accepted into the program will self-identify as a federally recognized minority. 49%, either as a minority or a blended minority. So the diversity of the program is highly encouraged. We don't look for any work or specific education requirements. They can have any kind of bachelor's or master's degree. Like I said, we had English literature majors. We have associates now in the program who have violin studies as educational background, who volunteered at a health fair, who is doing exceptional work as an associate. So they do not need to have specific background, work, or education to be considered as viable candidates. The next question says, how can a candidate make their application stand out given that it's submitted via the federal system that doesn't allow much flexibility? Okay, that's a very good question. The flexibility and the dynamicness of a candidate's application will come in phases 2 and 3 in the written responses. We'll ask a series of questions on their capacity and their experiences, nothing about public health. We'll ask them to talk a little bit about how they got involved in public health. So how they write and what they write and how they receive responses in written word and verbal word will help them stand out. All of the candidates that meet the basic requirements through the federal system will get referred to us, all of them. We had 950 that got referred to us last year of the 2,400. So the federal system is not a precursor to get them weeded out, but to include their applications. It says, do letters of support sway the reviewers? We do not accept letters of support. Unfortunately, letters of support are not part of the application period. Okay. Next question comes in. How do you identify those characteristics from a resume? It's very difficult. We do not do it from a resume. We do it from the written response in the personal statement, as well as our talking to them verbally. We'll talk to them about their experiences. We'll talk about how they got interested in public health and so forth and so on. But we do not do it from a resume. A resume is the first step to get them in the door. The rest comes through the personal statement and the actual interview that we conduct virtually. Next question says, has CDC ever considered giving associates a one-year assignment at one location, example, a health department, then move to another assignment for the second year? It's a very good question. Let me talk about creativity. We encourage host organizations to focus on creatively submitting applications. That might mean collectively joining with another host site in the area that their host site is located to combine opportunities for them to work in one location for 1 year and another location in another year, but in the same subject area. For example, in Kansas City, we had a local health department that was working on environmental health aspects of the local community. They wanted to partner with the EPA that was federally based, but in the same county, working on EPA-related environmental health issues. They partnered in their application. They actually came up with a co-application with one host site supervisor, one subject area, but 2 locations. We do not allow 2 separate one-year applications. The associate will stay at the same organization or partner with another organization during the 2 years, but the same subject area, okay? Next question comes, what process does CDC follow to ensure diversity of applicants? I'll tell you this, we do nothing. The applicant pool is a very diverse applicant pool just by virtue of the website and word of mouth. We use our associates as ambassadors. We're graduating 183 this year, and by word of mouth, they will encourage other candidates to pursue PHAP as a potential career step in their careers after graduate or undergraduate school. But this is one of the most diverse programs across the agency, and I hate to say it, we do nothing. We'll reach out to organizations, for example, that are American Indian, Alaska Native in nature. We'll reach out to Latino, Hispanic organizations. We'll reach out to HBCUs, okay, and make sure that we encourage HBCUs and Latino and Hispanic organizations and American Indian, Alaska Native academic institutions to encourage their applications to come from their students. But other than that, the application pool is very diverse on its own. Are there prompts for personal statements in phase 2 of the application? There are. When the application opens up in phase 1, the applicants will be informed of the questions that we will ask on the personal statement. It'll say you will be asked in phase 2 to respond to these questions. So they will have some kind of preemptive opportunity to actually hear and read the questions and prepare their personal statements accordingly. Okay. Next question says, do candidates have an opportunity to talk to current or former associates to find out what the position is really like during this interview process? Absolutely. Absolutely. If a candidate would like to talk to a current or former associate, we encourage that. We have a PHAP help desk called phap@cdc.gov. phap@cdc.gov. All they have to do is send an email to that. We will connect them with a former associate or a current associate who's in the program that they can talk with and get an idea of the application process, the interview process, the actual experience that the associate is having during their 2-year training assignment. Okay, we've got 3 more questions in the chat, so let me read through them and we'll go through the actual chat as well. Are international students who graduate from a U.S. college with an F1 visa and work authorization eligible to apply? Foreign-born students are eligible to apply as long as they are A, a U.S. citizen, B, a permanent resident, or C, a U.S. national. Those are the 3 criteria for students from an international perspective. They must be a U.S. citizen, a permanent resident, or a U.S. national to apply. Okay. The question says, this overview makes the process seem fairly straightforward. By my experience advising students through the application process is that it is extremely competitive and not much communication is given to the applicants about how they can be successful applicants. Can you give us any information on how we can help our students be competitive applicants? It's a very good question. The pool is very competitive. We have over 2,400 applicants and we'll choose 183 individuals. My suggestion would be for them to be patient, be committed to the process, and be diligent to follow up on their application. Okay, be diligent and be committed to the process, be patient. Okay, the actual individuals who get referred to us, all of them will be invited to respond to the personal statement. So creativity in their writing would actually stand out to us. Those of them who meet a certain criteria will be interviewed. Those of them who can string 2 words together and make a complete sentence would be ideal candidates. They do not have to have public health experience. They do not have to have academic experience in public health. They just have an interest in helping people, be service-oriented, have a passion for what they understand public health is, and be interested to be federal government employees. Okay? Can you tell us more about the matching process of candidates and host sites? Yes, this is a very complicated process that we go through. We'll have a list of the actual host sites whose applications we've accepted to host an associate. We'll have the list of associate candidates who've applied who would be deemed as successful candidates. We ask the candidates where they would like to geographically go. Sometimes it's not financially feasible for someone to relocate from Maine to Southern California, but they might go from Maine to Rhode Island or Vermont or New Hampshire. We'll take that into account. We'll take in the area of subject area of interest that the candidate has. For example, they might want to do obesity prevention in the state of Rhode Island, and they're coming from Vermont. And this is within their geographic preference. So we'll work with it. It's a fine art. It's a fine art, but our success rate has increased tremendously in getting candidates to stay in programs that, number 1, are geographically desirable to them, and B, the subject area is an area that they have an interest in. The second part of your question says, do candidates get to rank a list or know anything about the host sites? Unfortunately not. Unfortunately not. We'll make one matched offer to an associate. The associate will then have the opportunity to say, yes, I'll take it, or no, I will decline the offer. But they're not based on a number of opportunities. They're based on one match, based on the criteria that they provided us with, saying that they would accept it if it meets these criteria. Okay. It's 12 o'clock, Tracy. I want to be sensitive to time. Do we have a couple minutes to go over some more questions, or should we end the call?
I am open if you have the time.
No problem. I'm more than happy. I can spend a couple more minutes. That's no problem. It says, how many choices will a candidate have for potential work sites? Like I said, there's only one opportunity, but as long as they are within the criteria that they've identified they have an interest in, then hopefully the associate will accept the match and we'll have a good match and we'll have them in the program for the 2 years. let me ask another question came and says, what is the pay that associates receive during the 2 years in the training program? Is pay based on the cost of living of the field assignment location? Yes, they're paid at a GS5 level early career public health professional. It's usually in the mid to upper 30s is the base salary. There is a cost of living adjustment that is made based on the host site city and state where the associate will be working. For example, if they're working in Denver, Colorado, the cost of living in Denver is a little bit more than it is in Warren, Ohio. So the person who's moving to Denver might have a cost of living adjustment that ups their base salary from mid to upper 30s a little bit higher to offset the cost of living. Okay, but there is a cost of living adjustment. In year 2 of the program, the associate will be promoted and will increase their pay to another about a 4% increase in year 2 of the program. So they will have an increase in year 2 of the program through the first year of PHAP. What is the latest date applicant can graduate or complete the degree to be considered for PHAP? They have to have their degree conferred before July 1st of this year, before July 1st. So if they get their degrees conferred July 1st or sooner, they're eligible to apply. If it's July 1st or later, they've got to wait until next year. But July 1st or sooner is the time for an associate to receive their degree, and it's got to be within 2 years. So it's got to be from, this is 2021, 2019 to 2021, July 1st of 2021. Can you also please post the slides? Yes, I believe they'll be posted on the ASPPH website, but I'll defer that to Tracy for future, for responding. And then, is there a flyer or image that we can use to help the program? Yes, on the PHAP website, cdc.gov/PHAP, there is a link to a fact sheet that is our 2-page flyer that you can send to associates, candidates, you can share, you can print out. I will share it with Tracy, so Tracy can also share it via her mechanisms accordingly as well. So Tracy, that addresses all the questions in the Q&A. Are there any in the chat that we need to review?
There was only one that I saw, and it was actually about host sites. And so I'm not sure if you want to address that here or not.
No problem. If you want to throw it out, we'll see what we'll see what the question is.
We have an academic research center that's unsuccessfully applied to be a host site several times. How competitive is the host site application process, and what can they do to be more successful in their application?
No problem. That's a very good question. The host site application process is competitive, but not as competitive as an associate candidate. The host sites, we have about 500 applications for host sites, and those we reduced down to 180 to 200 host site applications. I'm going to give you a link to a website that gives you 7 characteristics of a quality PHAP training experience. It's called the CoStar model with 2 R's at the end. CDC loves acronyms. This is the 7 characteristics of a quality PHAP application. This is the technical assistance needed to give to our host site applicants to make them competitive. If you adhere to these 7 characteristics, guaranteed your application will be considered competitive. Sometimes a competitive application is accepted, but we can't make a match. We can't find an associate who is interested in relocating to the city and state or accepting the assignment. So there's a couple steps that the host sites have to go through as well. Accepting your application is one step. Finding the right match is another step in the process, but it's through the CoStar model. It's on the PHAP website, cdc.gov/PHAP. Under Becoming a Host Site, there is a webinar. It's about a 30-minute webinar. It's called PHAP 201, the CoStar model. Click on that. It's in the public domain. It will walk you through and give you technical assistance on things that you may have not considered in previous applications that will up your competitiveness for your application for 2022. I hope that helps.
That's great. Thank you so much. I know I learned a lot, and it sounds like our attendees did as well. So thank you so much for your time, JT.
You're
And we
welcome.
will have these, the recording from today available by next week on our website, which I've posted a couple of times. So thank you all.
Thank you, Tracy. I'll send you the link to the website as well.
Thank you.
Thank you, everyone. Good luck in the process. And if you have any questions, feel free to reach out to us. Thank you, everyone. Take care.
Thank you.
Bye.